Hi, Dr. Zac Watkins here, and this is short notice, and I want to apologize for the lighting and probably my hair. It's been a long day, so I apologize. But what I've been reading a lot is there's a lot of popularity going around now about, they're talking again more about gluten foods. Is it really a good deal? Is it a fad? There's celebrities doing it, there's books doing it. There are even reports or an article I read about some practitioners or some clinicians, some researchers saying that is gluten-free even a good idea, because if you do that, you're going to be losing your calories and you're going to waste away and get sick. So a lot of misconceptions, but at the top of my head, from a functional medicine perspective, I want to show you why it is important to think about gluten sensitivity. Now, one of the questions I want to ask you is, have you tried going gluten-free before? Have you tried eliminating gluten from your diet? Now, gluten being wheat, things like pasta, cereal, and pretty much anything in a box. Twizzlers, if you've read some of my articles, I mentioned about Twizzlers having gluten. But you still have symptoms. So you eat the gluten, or you're going gluten-free, I'm sorry, and you're still having symptoms. So maybe this hype is not what it cracked up to be, you know. So I want to show you briefly what goes through my head when I'm thinking and when I'm talking to patients, and explain to you why I think gluten still potentially is a problem. I want you to think about that too. So this is very messy, and again, I apologize. The sun's coming through. I'm lazy and I haven't got around to buying blinds. So you'll have to forgive me. And so basically what happens is when we have an increase of gluten in the diet, gluten foods, wheat, barley, rye, oats, pasta, cereals, things like that, if it's an inflammatory food, it's going to cause increase inflammation to the GI tract. So you're going to have increased inflammation in the GI tract. It's going to upregulate the immune system. It's going to give you some issues on an inflammatory basis, maybe not symptomatically. Now, why that's important is when you increase GI inflammation, the first thing that happens is, well, there's a couple things that happen actually. You're going to, over long-term, decrease your nutrient absorption. You're going to decrease your capability of the way you absorb nutrients from your foods, from supplements. You know, people these days take so many supplements and they're expensive if you get good ones. How do you know you're getting the right ones? You know, so if you have low-grade inflammation, you're going to have trouble absorbing these nutrients. The other thing with higher inflammation in the GI tract, again subclinically, is that you're going to get this higher level of inflammatory hormone output, cortisol. And we've talked about that numerous times in articles and videos. But our cortisol, our stress hormone, when that increases, that's going to elicit kind of this response in the body that drives hormones and has these other implications for health, like fatigue, sex hormones, on and on and on I could go. So as we increase our stress hormone, it actually over long term decreases our immunity in our GI tract. And so again, I've mentioned before, you might have heard of people taking corticosteroids, prednisone, and things like that. You're going to decrease your immunity long term. It's called secretory IgA. It's the lining of your GI tract. It's in your lungs, vaginal canal, sinuses. When you decrease your immunity, you're more prone to things like infections and bacteria and not digesting well. And you know, the process just keeps going on and on and on. So I come back to the question, if you go gluten-free, why do you still have symptoms? This should not be happening, right? Well, if you go gluten-free and you're still having symptoms, what I propose to patients and propose to you to think about is, have you even ruled out inflammation in the GI tract? Other things that can contribute are bacteria. I won't write it out, but bacteria. Now, if you have, let's say you have a long-term problem with your immunity in the GI tract, maybe due to many years of gluten, poor blood sugar management, those things like that. And this is going on long-term. Now, again, you don't feel it really. Now, if that happens, you are going to be more prone to infections and not digesting foods well. So going gluten-free is a great thing. I tell patients that all the time. You're doing a good thing if you're not eliminating symptoms, there's probably more to the picture. And I think that's where a lot of people don't investigate further or think about that. So if you've eliminated certain foods for a while, food elimination diets and stuff like that, still having symptoms, I propose to you that you got to investigate further. You're doing the right things, you're on the right track. You just haven't eliminated things like, what is your GI inflammation status? Do you have other infections? What is your inflammatory hormone doing? Cortisol. If that is not working well, you're going to have perpetual problems in the GI tract. Here's another one that I talk about. What is your nutrient levels? People always ask, is there ways to test your vitamins and minerals and how well your body's working? Absolutely there is. There's a test we use in the office that checks not only vitamins and minerals and things like that, but how healthy your immune system is and all that kind of thing. So all these things play into that. So eliminating gluten and gluten-containing foods, for some people, they lose 30 pounds in a month. Wonderful. That's excellent. Other people, no problem. They have problems. They have more problems. They have constipation. They have, perpetuates the issues. And they think, well, this isn't for me. This is a big joke. You're individual, and you're different from your next person. You're different from your parents. But there is a thing about genetic tendencies. So I really encourage you to think about, if you've eliminated certain foods like gluten, still having trouble, that possibly there's other things going on in your GI tract, not absorbing well, your inflammatory hormone, even your long-term poor immunity. So at our office, what we tend to do and encourage people is to investigate all avenues regarding their symptoms, not just, let's just eliminate gluten and everything's good. Everybody's different. Please email my office at drzacwatkins.com with any questions, and stay tuned for some more videos. I hope this has served you, and please have a good day.